I am very pleased to welcome to the program former Senate Majority Leader Bill Frist, who's a medical doctor. He's a Republican from Tennessee, a heart transplant surgeon who actually has quite a lot of experience when it comes to pandemics. He was on the ground in China during SARS. Back in 2005, we talked about President Bush and his prescience last week, and we did the flashback clips to 2005. Senator Frist was also at that time calling for a Manhattan Project for the 21st century in terms of preparing the U.S. for global pandemics, and now here we are. He is a member of the Heritage Foundation's National Coronavirus Recovery Commission, where they put together a 5-phase plan for getting the country back on its economic feet in a way that is sound scientifically and medically. And Dr. Frist, Senator Frist, obviously has a unique set of experience, and his CV, I think, makes him a totally logical person to have on such a task force and this commission that Heritage has put together. Senator, thank you for joining us.
Guy, great to be with you today. Thank you.
So if you would just walk us through, big picture, these 5 steps, and I might interject with questions from time to time, but talk about the work product that your group has put out.
Guy, our focus of this particular commission is the recovery and restoration from the COVID-19 pandemic. What policies we should put in place to get things going again to reopen. The big picture is that, and people generally agree that there are about 4 steps that need to be done. We need to stabilize the number of cases over a week or a 2-week period. We need to make sure hospitals coming out of crisis mode, getting through these surges that we talk about every day. And then testing. We've tested insufficiently in the past. As they come on board, we need to ramp up aggressively and make those tests available for all symptomatic patients. And then we need to be able to trace contacts out there. So those are the fundamentals we're focusing on today. What this commission does, it looks at that next phase. How do we begin to reopen, reestablish, bring people back to work in as safe a way as possible in this time of uncertainty? So the 5 stages, I won't go through them all right now, but basically get people back to normal business activity as soon as possible, but doing it at a regional level. Number 2, slow, and this is what we're doing today, slow the spread of the coronavirus, at the same time expanding that testing. And number 3, continue to build on the science. Have it real science, accurate science-based as that data is accumulated. And then 4th, come back in with U.S. leadership and leading the world in terms of economic recovery. And then the last thing we need to do, but something that I started, as you mentioned, back in 2004 and when I was majority leader, is begin preparing for these pandemics. These viruses will come back. This sort of pandemic will occur in the future again. And that long-term thinking, very hard to do today when we're in crisis mode, is something we absolutely must be doing as well.
Yeah, and it doesn't feel like an urgent priority, but to stave this type of thing off in the future, I think it's a no-brainer and should have been a no-brainer, frankly. And you were working on it many years ago, and for various reasons, balls were dropped, let's put it that way. But I want to just circle back to a few points that you made. You talked about the importance of stabilizing cases and then starting to get that, not just the curve flattened, but onto the down slope. Based on the data, based on your knowledge, do you feel optimistic that we're getting there?
Well, in some communities, we clearly are. We've seen this huge surge in New York, a bump in Washington, a very serious surge there, and they are peaking now. There are other parts of the country that have not seen that surge yet. A lot of the rural areas won't be seeing their local surge. And remember, they don't have hospitals to go to, and they don't have facilities to go to, so that surge there will be very dramatic and painful. Most of those rural areas, that surge has not occurred, and therefore this regional approach, not just state by state, where a lot of the focus is, but city by city, precinct by precinct, zip code by zip code, they can start coming alive slowly over time, but it needs to be done in a coordinated way, and we need adequate tests to be able to see whether or not opening a little bit over time, do we have to titrate it back with tightening the social distancing and the restrictions, and that process is going to probably go on over a period of as long as a year over the next 12 months.
Oh, wow. Well, here's Dr. Anthony Fauci on CNN talking about sort of a rolling reopening, almost to your point. It's not just going to be a blanket approach for everyone. Here's cut 18. Listen to this.
When I said a rolling reentry, it is not going to be a light switch that we say, okay, it is now June, July, or whatever. Click, the light switch goes back on. It's going to be depending where you are in the country, the nature of the outbreak that you've already experienced, and the threat of an outbreak that you may not have experienced. So it's going to having to look at the situation in different parts of the country.
So that sounds, Senator, like what you're talking about a little bit. I guess the question is, you said it'll have to be achieved using granular and huge amounts of data and done in a coordinated fashion. So I guess it's a two-part question. How much data, like what's the threshold of data that you think we need to make smart decisions on this front? And then who should be doing the coordinating?
Yeah, in the big picture, and it's hard to talk big picture because I'm going to keep saying come back locally, but we need about 250,000 tests a day of the capacity to perform that. Right now, maybe at the end of last week, we had 150,000, so we have to ramp up that testing so we'll have some objective measure. For example, in Nashville, Tennessee, where our mayor came out pretty earlier than our governor did, of social distancing enforcement. If we want to begin to reopen, we're going to need to start reopening today or soon. It might be a week from now, maybe 2 weeks or 3 weeks, and then be able to measure objectively, ideally with tests, but the tests aren't there yet, but hopefully in 2 weeks they will be. Just for example, what we probably would start with is large businesses, and again, this is hypothetical, but this is the way I would do it at least initially. Start initially with large businesses, even large corporate workplaces, because they have the possibility for better enforcement to social distancing measures. They can spread out desks. They can work on Saturday or Sunday. And then start opening by small businesses, which is really the core of our workforce today, and we've got to get there as soon as we possibly can. And then slowly shopping malls and retail shops, making sure that people all the time avoid crowded places. And then the last to open up would be the large gatherings, the big festivals and the big concerts and the big conferences, the big sports events, unless in some way they can assure a 6-foot distance. It's just harder to imagine. And then it comes to schools and colleges, a huge debate there in terms of when we should have people come back to schools. And that is, we can talk about, no, we don't have time to talk about now, but it's a big issue that a lot of people are thinking about.
Sure. And so let me just follow up then, because what you're saying to me makes a lot of sense. And, you know, I'm a conservative. You're a conservative. We believe in states and local governments making determinations for themselves as opposed to top down from the feds. But also, if you have the very smartest people at the federal level, like the Faucis and Birxes of the world, saying, okay, in order to make this work nationally, because people travel, right? It's not just communities aren't as isolated as they once were. There needs to be a holistic approach. What do you think is the appropriate relationship to strike, where there might be guidance from the federal level, but implementation with some flexibility for governors? What would that, across levels of government, in your view, especially given your experience, what might that look like?
Well, I think you hit it exactly right. In coming into this, we were late to the game. We were late to the game in terms of testing, in terms of recognition. I'd spent time in China, as you pointed out earlier, with SARS, and they were very late then. They were late coming out now. We were late to the game. But given that being the case, we had to come in with this blanket shutdown across America, and that was enforced and executed through the states themselves. Coming out of this, and this is what we'll look at to our commission, it can't be this blanket recommendation. You can't just say on June 1st or May 1st you're going to open up America, because the disease itself, the virus, which knows no state borders and knows no national borders, but it gets into a community, and that unfolding is going to have to be at the local level. So the communication, the guidelines set at the national level, the governor speaking for a geography which is varied as Tennessee, but ultimately it's going to be at the level of the local community, of the mayors, the town councils that are going to have to decide how to reopen and when.
I want to take one last opportunity here to ask a broader question, and I just want to point out, if people are curious about these 5 phases that we talked about in this group that Dr. Frist has been a part of with the Heritage Foundation, you can go to heritage.org, and you can look for the National Coronavirus Recovery Commission. There are some conservatives, and I'm sure a good number of people listening right now to us, Senator, who look at what's happening, and they truly believe that there's been an overreaction by the government. And they say, okay, these models were showing all these dead people, and now the numbers keep coming down, and we've really destroyed people's economic lives and businesses, and this was all a huge overreaction, and the president maybe needs to start exerting his authority, and governors need to start listening so much to the eggheads and realizing how we're hurting out here. And I'm sympathetic very much to the people who have huge economic problems right now, and we're basically shut down as an economy. It's awful, and it's very painful. Just as a doctor and also someone who has worked specifically on these issues in the past, which we've alluded to, what's your message, what's your response when people sort of on our end of the ideological spectrum say, okay, enough is enough, this thing, maybe it wasn't a hoax, but way overblown? What would you say to that?
I'm a scientist, and it comes back to my life has been taking care of patients, transplant patients, and immunologically challenged patients, immunosuppressed. And just based on my experience, you do have to go back to the science and the data, and that changes day to day and it's improving. When we came into this, one person who had the virus, but within about a week or 2 weeks, they would infect 5 people. We knew that. That's based on millions of patients in China, in Singapore, in Europe, in Italy. We know that. The virus itself knows no borders. The biology, it's a cagey virus. It moves faster than us. And we know through the social distancing, the 6 feet, this mandatory, none of us would have imagined it a month ago, but this mandatory keeping away from people has now slowed that down to one person who has that virus will infect only 1.3 people. And that explains the flattening of the curve, the impact. In retrospect, that number, or the numbers are coming out today, but you have to trust that data. If you don't trust that data, the data it's been verified. It started globally and it stays nationally. If you don't trust the data, it's hard to, it's going to be hard to convince people. But if you look at the science, you look at what Fauci generates, you look at the CDC, the epidemiologists, who are the smartest people who've studied this over decades and decades, they will agree with that data. So the social distancing, the great sort of calls from the president and the calls from the governors has had a dramatic impact, and therefore we haven't seen the deaths. We have in New York, but we have it in other areas, and that's a real blessing so far. It's going to get increasingly hard because there's a huge economic impact. People lose their jobs. They can't put food on the table. They're not going to be able to buy their prescription drugs. Kids are not in school. That's a huge economic impact, but it's an impact that it took in order for us to get to this point of safety and security and saving lives where we are today.
Bill Frist is a medical doctor. He is also former majority leader of the United States Senate, a Republican from Tennessee, part of this group with the Heritage Foundation. Really sensible stuff. You can go to heritage.org for more information. Dr. Frist, Senator Frist, we so appreciate your time. Thanks for doing this today.
Yeah, great to be with you. Thank you.